Hello everyone. From today, we will launch a series of introductory lectures on OCT. Today is the first lecture of this course, where we will introduce optical coherence tomography and the image interpretation. I am Dr. Kong-Ling Kui, PhD, from the Department of Cardiology at Zhongshan Hospital, Fudan University. As for the third part, we need to accurately identify various types of thrombus. Red thrombus are primarily composed of fibrinogen that becomes activated and converted into fibrin. They are commonly observed in acute ST segment, elevation myocardial infarction, STEMI patients, typically presenting as transmural infarction. On optical coherence tomography, they appear as highly reflective region with strong signal attenuation. This characteristic morphological presentation shows strong correlation with pathological findings. White thrombus, primarily seen in non-ST segment elevation myocardial infarction patients, usually demonstrate subtotal occlusion of the lumen. Patients with unstable angina may also exhibit similar manifestations. On OCT, these white thrombus are generally smaller in size, showing low reflectivity and homogeneous weak optical attenuation. Furthermore, we can sometimes observe that while the intima remains intact, the endothelial surface appears irregular. Furthermore, evident plaque erosion is observed with localized minor thrombus. In addition to these, we encounter mixed thrombi, which likely represent the most prevalent type in coronary vessels. The majority of extracted thrombus are mixed type, as even in STEMI patients, the initial phase involves platelet aggregation, followed by coagulation cascade activation. This gradual process leads to full coagulation cascade initiation. These two mechanisms are interconnected, rather than entirely two distinct processes. Therefore, mixed thrombus likely constitute the predominant clinical cases. That's all for today.